Hello, I'm Lisbeth Votruba, Chief Clinical Officer for AvaSure, and welcome to our part one of a 6-part learning series on virtual nursing. And our session today is the role of the virtual nurse. And we'll be really talking about the domains and competency that's involved in that role, which is just a linchpin for the success of any virtual nursing program. And so it's noon here on the East Coast. So those of you that are around lunchtime, I hope you grab your lunch and sit down and get comfortable, but be ready to type in questions and interact. This is a learning series, so we really want it to be even more interactive than we usually are. And I know here our headquarters are in Michigan, and it's a kind of a cold day, and we are having our annual chili cook-off. So Terry, sorry you can't be here.
Yeah, apparently I should have made a trip to Michigan.
It smells fantastic. I mean, just like our break room is full of slow cookers, so I can't wait to go sample.
Is there judging too, though? Because there always has to be judging. Okay.
But we have a fun trophy for that. But anyways, let me introduce you to my guest, which is Terri Hinkley. And she was hired by the Academy of Medical Surgical Nurses and the Medical Surgical Certification Board in August of 2017. And she has over 32 years in acute care nursing in the healthcare setting. She has 10 years of association management and staff experience, having held executive positions in both individual membership associations and certification boards. She was elected the president of the American Board of Nursing Specialists in July of 2021 and is the director on the board of directors for the Institute for Credentialing Excellence. And I have witnessed your expertise in credentialing expert. So we'll talk about that. And the Nurses on Boards Coalition, I love that. I'm on there and I get emails occasionally. So anybody who's listening, sign up for the Nurses on Board Coalition. And the Atsuko Patient Assistance Fund, she received her RN from Centennial College, BSN from New York University, an executive MBA and an ED doctorate in the Executive Leadership Program, Human and Organizational Learning Program at George Washington University. So very experienced and qualified to help lead in this work. Before I get started, I'd like to just do a quick audience poll about what has prompted people to attend today. We had about 250 people register, so a lot of interest in this topic. So are you an AvaSure customer who just wanted to learn about some new use cases for the technology? And then it kind of goes from a range from virtual nursing is not even on your strategic plan as an organization, but you're curious to learn more, or you are starting a virtual nursing program and want to learn more. You already have a virtual nursing program and looking for a learning community, or it's on your strategic plan and maybe you've been assigned to the team and so maybe even assigned to attend the webinars. So let's give people a second to do some voting on what prompted you to join today. And since you have a doctorate in education, you know that knowing about what your learners are interested in is key.
Absolutely. A great way to start the webinar.
All right, let's see where it's coming out. All right, so kind of a mix. Many are starting a virtual nursing program or it's on the strategic plan. So, and fewer have a virtual nursing program already. So, okay, great. Well, welcome everyone. And I can't wait to dive into this conversation. So what prompted me to invite Terri is the Academy of Medical Surgical Nurses has decided to launch a certification on this topic. So maybe Terri, you can talk a little bit about the difference between the two organizations, which you lead both of them, and also what prompted you to explore a virtual nursing certification.
Sure. Yeah, happy to. Good afternoon, everyone. It's such a pleasure to be here with you all, and I'm so excited that so many of you are on this journey to virtual nursing. I think it's really exciting, and I think it offers a lot of opportunities for nursing as a profession. So AMSN is a membership organization, so it's focused on education, advocacy, supporting medical surgical nurses wherever they might practice, and providing tools and resources that they need to be successful in their roles. And the Medical Surgical Nursing Certification Board obviously focuses on one component of that, which is certification or credentialing. So our flagship certification is the Certified Medical Surgical Registered Nurse, the CMSRN. And we are developing, and we're in the midst of developing, a new credential for virtual acute care nursing. I think that for AMSN, they're certainly interested in education and supporting this new emerging practice setting, and for MSNCB, quite interested in some standard setting through the credential, Lisbeth, as a means to sort of bring some uniformity to what might be employed at hospitals across the country.
Great, yeah, add credibility and some uniformity. And that kind of brings me to talk a little bit about the task force that I participated on. And we have a picture of everyone who participated. So Terri's organization compiled this group of thought leaders here and flew us all down to San Antonio for 2 days. And we really grappled with this. And I want to compliment you on how that was organized, because we all had pre-work and we spent our time you guided us very wisely to really accomplish a lot. And I think just when we were introducing ourselves around the room, it was great to meet each other, and because we were all looking at this from different views, but also there was some impassioned and I remember even myself talking about, we as nurses need to take the lead on new virtual care models and define it ourselves, or it will be defined for us. So this group of team, we really worked on, while we were down there, defining the domains of a virtual nurse and the skills and competencies and the beginnings of the blueprints for this exam and certification. And then we were assigned percentages and value and weight to those domains, competencies and skills. And I think that let's see, and can you, oh yeah, I know. So that was the beginning point, is kind of define that. Then where are you going from there to get all the way to a certification exam?
Yeah, so I think first and foremost, we felt that this was an exam that was certainly needed within the industry. One of my roles as CEO of both AMSN and MSNCB is to understand where the practice is going, and to always be looking for what is 2 years down the road, 3 years down the road for medical surgical nursing specifically. And we were hearing a lot and seeing a lot of this kind of emerging virtual acute care nursing. Now, I will say it was around before the pandemic. There were some hospitals very early on that had looked at this as a care model, but it really sort of accelerated, like many things, accelerated and amplified during the pandemic. And so I was seeing a lot of conversation, a lot of articles about this sort of being the future of acute care nursing. And I certainly had recognized during the pandemic, especially, the value and utilization of telehealth, or sort of that non-acute care model. And we certainly saw that kind of explode during the pandemic, where people couldn't get in to see their providers. So telehealth and telehealth models of primary care became really popular and quite favorable. Patients like it a lot. So seeing this emerging area in the acute care space, I thought was really quite compelling. So started having conversations with the board for both MSNCB and AMSN that this seemed to be something that we should be very aware of. And we felt that because medical surgical nursing in the acute care space, and I will differentiate between acute care and critical care, in the acute care space, medical surgical units are the majority of the units and the nurses in the hospital setting. So we felt that we could play a role here and we could certainly support this work. So that's why we undertook the exam. Now, when we start developing an exam, Lisbeth, you talked kind of like we led you through, like we do this and then we do this and then we do this, and that's exactly right. The test development process is pretty clearly defined. So we start with a definition of what it is or what the area that we're going to provide the credential for. So we were really explicit that it was virtual acute care nursing so that it wasn't confused with telehealth and it wasn't confused with outside of the acute care setting. And then we compiled subject matter experts from around the country, and I turned into quite the LinkedIn sleuth, if you will. I read articles. I tried to find the subject matter experts that were writing the articles, and I would stalk them on LinkedIn and send messages. And then I would do a little bit of snowball sampling and say, if you know anybody else that's doing this, come and join us. And we ended up with an absolutely outstanding group of thought leaders in San Antonio, just ahead of AMSN's annual convention last year. So those experts help us build the actual certification program, and it starts, like you already said, with defining the domains or the exam blueprint. And then part of that exercise is what's the frequency and importance of that work or those domains of practice within the specialty or within the area for the credential. So we actually had to assign weight to the importance of and frequency of those activities. Once we have what we call an exam blueprint or a content outline, which we will show you on a next slide, I think, then it becomes sort of getting down to brass tacks and actually writing the exam. So we work with volunteer subject matter experts. Again, we never presume to have the knowledge to write these items. We bring volunteers in, they write the exam for us, they write the questions, and then we, assemble the exam, test it. So we do something called beta testing where we actually test it and set a passing score based on those results and then launch the full exam. So that's sort of the process, and we're midway through that right now.
Yeah, and while we were there and convened in San Antonio, in the next conference room, there was some item writing for your other certification, the CMS certification, and it was great to have breakfast with those and lunch with those nurses. And they, am I right? They tend to be nurses who are actually right in the front line. Correct.
Absolutely doing the work. Yeah, 100%. And that's really important because that brings the legitimacy to the exam so that you're having the people doing the work that are actively dictating both by setting the domains and the content outline, but also writing the exam questions. And that's a really important part of exam development for us.
Yeah, and I thought what I noticed just interacting with those nurses that were doing item writing while we were there is it's a professional development step for them, or it's just a great thing for them to kind of get out of their day-to-day and something to maybe even put on their resume or
100%
growth. So those of you that already have a virtual nurse program underway and have virtual nurses who are doing it, are you still looking for item writing or?
I'm not looking for item writing. So we're in the process of item writing right now, but I would love, and if anybody is interested, please contact me. I'll share my email address. We're looking for item reviewers. So we have to have a separate set of volunteers than the ones that wrote the questions, actually review them, make sure that they're accurate, make sure they're well worded, they're not misleading, and help us assemble the exam form. So yes, I am still looking for volunteers. The work can be done virtually. We certainly do provide contact hours. If you hold certifications, you can get contact hours for that work that you do for us. So please do reach out, feel free to reach out to me and say that you're interested in item reviewing, and we will connect and get you set up.
Okay, that's awesome. Now let's go ahead and talk about the 7 domains that we as the task force defined as the foundation for the blueprint for the exam. And I'm going to show that up on the screen and we'll kind of drill down into a few of them. But do you want to do a quick overview on these 7? And then there are 3 of them that I want to talk in more depth about.
Yeah, absolutely. So the subject matter experts that we worked with in San Antonio, all of whom are leading, building, developing, or executing virtual acute care nursing programs currently within their institutions, settled on sort of these 7 domains as the important ones for virtual acute care nursing. And the first is quality and safety. That includes things like monitoring quality indicators, watching patient care compliance or surveillance activities, as well as regulatory compliance. Making sure that we recognize scope of practice between licensing boards across states, because oftentimes virtual nurses can be practicing across states. So we know that there's a consideration there, but really looking at monitoring and, as much as possible, predicting interventions related to those core measures or nurse-sensitive indicators. So that's an important domain, and you can see that that was weighted at 16% of the exam content. The second, patient and family education, we have heard from the folks that participated not only in the task force, but also item writers, that patient education is a large part and an important part of what the virtual nurse does. Some facilities use them to do admissions and discharges and all of the education associated with that. It also includes individualized patient education based on their care plan, as well as care plan oversight sometimes. And then considering, especially closer to discharge, things like the social determinants of health and the access patients have to the services that they need post-discharge.
And on that patient education piece too is the orientation to the role of the virtual nurse.
Yeah.
And maybe a little bit about the technology and so that's embedded. One way that the technology piece is kind of embedded in almost all of these domains.
Right. Yeah. And we'll talk about that when we get down to sort of that domain 7, the informatics and technology. Some folks might be, well, that's only 20%. Well, yes, because to your point, it's embedded throughout the other domains, and the particular specific informatics and technology knowledge, skills, and abilities the nurse has to have is important, but it was not standalone. As when we were talking about even quality education, like you mentioned, coaching and mentoring, the technology and the informatics necessary were threaded through all of those domains.
Yes.
So our other larger domain was communication at 20%, and that's communication not only with the patient and the patient's family, but also with the care team, because the virtual nurse is part of a care delivery team, including a bedside nurse, and there's a significant amount of their work is related to communication, developing rapport, understanding virtual etiquette, and what that looks like. And then communicating it, as to your point, or educating patients and families about it in that previous domain. So communication, certainly critical to this role. The fourth domain, teamwork and interprofessional collaboration, sort of builds on that communication. And within that domain, which is weighted again about 17%, you see things like collaboration and teamwork, delegation, so delegating to the interprofessional team, understanding the chain of escalation and resolution to make sure that if needed, the virtual nurse knows how to escalate or resolve things that might need to be addressed, scribing, documentation, etc. That certainly belongs in there. The fifth domain, there's also a large part of the virtual nursing role. What we heard across the board, Lisbeth, with our subject matter experts in San Antonio, was that virtual nursing is not an emerging or graduate nurse role. This role is done by the most experienced and expert clinical nurses in the facility. And coaching and mentoring is a great way to utilize that expertise and experience of your virtual nurse to help the less experienced nurses that might be at the bedside. So we spent a lot of time talking about the importance of coaching and mentoring for this role and these nurses. Looking at feedback and support, precepting and mentoring, what those points of contact will be, reinforcing partnerships between virtual nurse and the bedside nurse and the interprofessional team. So coaching and mentoring a large part of what the virtual nurse does. Domain 6 is leadership, approximately 10% weighting for that domain. And that looked at things like prioritizing activities, situational awareness, just how important situational awareness is for these nurses, strong emotional intelligence, providing additional professional development to the team as needed, determining any environmental conditions that are important to consider from a workflow or touch point perspective.
Yeah, I remember us talking about prioritizing, for example, a virtual nurse would have maybe a little more global view of patient flow in the hospital setting, and say, I know there's backups in the ED right now, so I'm going to prioritize discharges so I can free up some beds. And so that's in a way a leadership level, like taking it to the whole organizational priorities, that type of situational awareness. Yeah,
and because they have more patients, because of their role and they're monitoring more patients, to your point, they're almost like an air traffic controller of sorts, would they? Yeah, exactly. And then the last domain, the informatics and technology, and that really, again, recognizing informatics and technology is embedded throughout by definition of the role. This really was focusing on understanding and demonstrating knowledge, skills, and abilities related to utilization of the virtual nursing technology, making sure to understand and be able to utilize the hardware and the software, address gaps in functionality or troubleshooting as necessary, adhering to privacy and security regulations and requirements, and then also looking at data management. And that's, looking across EMRs, EHRs, physiological reporting tools, whether that's sensors or equipment that might be connected, and monitoring that, as well as any databases for reporting.
So that's a kind of the overview, and just to know that we don't have like the luxury of 2 whole days to talk about this like we did when we were in San Antonio. I want to go to the next slide and kind of drill down into areas that I really felt were key and kind of unique to the virtual nursing role. And one being on the communication side that somebody said there, and it was webside manner. And that virtual etiquette and privacy concerns. And there's a real skill to that. And so I'm going to ask if we can unmute Wade Batt. He's from UNC Rex, and he is a virtual nurse thought leader. We didn't catch him for the task force, but I was able to go visit and meet the virtual nurses that he leads there in Raleigh, North Carolina, and they're definitely wisdom workers. And when I was there, seeing that in action, they just love. There was a lot of joy in their work, and they said to me, I think there were 4 of them there that day when I was there 2 weeks ago. Said, I think we probably have 100 years of experience amongst us here, and Wade, I got a real insight in how they used a virtual role to communicate and put patients at ease. So if we're able to unmute Wade, I'm wondering if you can just share a little bit about that.
Sure, Elizabeth. Thanks first of all for having me. Nice to virtually meet you, Terri.
Nice to meet you.
I'll share before I jump in that it's only going to be 75 degrees in Raleigh today, so we're having a terrible time down here. But no,
do you have chili? That's the question. Do you have
there is no chili? So I guess we're awash. we're very fortunate at UNC Rex that, you know, our patients have a lot of choice in their healthcare in the Triangle area, and they choose us because of the relationships that we're able to build with them. And that translated very smoothly into virtual nursing based on the experienced nurses that we chose for the program. They've all been long-term Rex nurses. They still count themselves as Rex nurses. And we deliberately built into the virtual nursing process time to build rapport with patients because, you know, there's that technological hump to overcome. Sometimes I think it's more imagined than real. I think a lot of people take this more easily than you think. But we do take the time to build that trust, develop that rapport. And we've heard it reflected that our patients appreciate it in comments like, you know, I feel like I have my own personal nurse, or can you be my nurse for discharge? And the nurses feel that our patients are able to sense that we're not as hurried, that we don't have a vocera going off or bed alarms across the hall or phones ringing, the 1,000 other things that we implemented virtual nursing to try to take off the plate of our unit nurses. And we're able to dig deeper and really, you know, talk a little bit about where the conversation takes us. If the patient wants to drive the conversation for 5 minutes, we'll come along. And that has translated often into them being more forthcoming with some sensitive information that they might not share with someone who they feel like is maybe not giving them 100% of their attention at that time. And that's the difference. We can convey that we're there for that patient in that moment 100%. And the patients love it, the virtual nurses love it, and one of their big hang-ups was, I'm going to miss the patients, but they get to actually spend more time with the patients this way. And of course, the unit nurses love it because it puts time back in their day. So we've been really, really happy with how it's worked out so far.
And
I think that's a great point.
Isn't it? And that, I mean, I think, and thank you for sharing that way, because I think that adds color to that piece of the pie about what the communication means. And one of the nurses the virtual nurses at UNC Rex said, I've done more pastoral care consults than I ever did in person because of exactly what he was talking about. The patients feel like they're unhurried. And so that's kind of a skill. And we are virtual right now. So I don't have like a wow in front of me and keep looking over and all kinds of, you know, beeps and alarms. And I think we were even talking about like when they're typing, and I'm fake typing now, that it still just feels like they're just listening instead of having a computer in between you and the patient. So, and not wearing a mask too. And oftentimes it's one of the only caregivers that's not wearing a mask. So that's a little bit about the communication piece of the pie. And I want to move over to the coaching and mentoring piece of the pie, which is so important. And I heard the CNIO at Yale New Haven said these are wisdom workers to me, and I love that. And so I've been stealing that, and that's what you refer to. Maybe not the novice nurse or the person who just happens to be on light duty but doesn't have that great, you know, gift for mentoring or need to mentor. And we talked about creating a space of psychological safety and how to give feedback and support. So I'm going to call out one of our task force members, who's Shannon Denny, and she's a co-author of one of my favorite articles. I think it's called Virtual Nursing, the New Reality, and we'll put a link so you can go get that article. But when we were around the table talking about this, Shannon, you talked about the reasons that bedside nurse reach out to virtual nurses on that coaching and mentoring side. And I'm wondering if you can, if we can get Shannon unmuted, and if you can talk a little bit about that.
Absolutely. Thank you, Lisbeth. Hi, Terri. Good to see you again.
Hello, Shannon. You too.
Oh, and Wade, I have to say, I was cheerleading and clapping when you were talking. I think you absolutely nailed it. I am so proud of the work that's being done nationally with virtual nurses and the virtual nursing service line. And I think you really summed it up beautifully. But let me talk just a few minutes about the coaching and mentoring that we've experienced at Common Spirit Health. We've been in this space doing proof of concepts and pilots for about 10 years now. So Kathy Sanford, Dr. Sanford, is really on the leading edge of this work and very proud of what we've been able to accomplish. But one of the things that we've been one of spaces that we've been moving into very quickly, and this has been requested by our chief nurses in the divisions that we have throughout our organization, is that need to have an additional preceptor resource, coaching resource. Now, I will say, just organically to the role of a virtual nurse in the acute care environment, you do coaching and you do a lot of mentoring. And we know that our med-surg nurses are oftentimes less than 5 years experience on the units. And if you have a nurse residency program in your organization, that is certainly supplemental and ideal to the work that they do in those tender first years. But oftentimes there isn't that organized nurse residency program to fall back on. And so we have found that our virtual nurses really serve in that adjunct or that supplemental role, if you will. So we began to really look at it in a formal way and have conducted a 3-month pilot in one of our Texas facilities, just to gain some learnings. What are the barriers? What are the opportunities? And really we're able to gain a lot of learnings from that. But yes, organic to the role in and of itself, when the virtual nurse is available to that bedside nurse, oftentimes they're called just for very task-oriented questions. I have to flush this med. I have a new procedure I haven't done. I have to call the physician and do an SBAR. Can you help me to prioritize how to do that? We get a lot of that. So we know that part of this role really does have to be mature enough to certainly be able to participate in that role. In fact, we are having our virtual nurses go through their preceptor training programs formally. So yeah. Well, I wasn't smart enough to figure that out at first, but as the demand really increased, it became obvious that we wanted to align ourselves with what the preceptors were doing on the units and certainly walk in the same direction with the same training. So that is required for us now. But yes, it is. I think it's a burgeoning role. And I will say, the limitations that we have discovered, and it's been fairly consistent. And limitations is always a fairly pejorative word, but sometimes technology can be that. And so in transparency, our nurses oftentimes wanted an on-demand. So I'm getting ready to do this in 3 minutes. Can you come on and help me? And oftentimes we have found that that's a bit of a barrier. And so what we've done to mitigate that is to say, Lisbeth, I know that you're new to this unit, or I know that you haven't done this procedure before, or I know that you perhaps have some questions. Maybe we can schedule a time to meet before you do this and walk through it. So we've seen that as really an opportunity.
That is really practical.
Yeah.
Great advice. Thank you.
Sure. Lived experience.
Yes. Yeah. And I love that piece where I think that's a great learning that they do part of are considered like preceptors and have that training. I had talked to a leader of a virtual nurse program, and she said that during COVID they had a novice nurse managing like a higher load than they ordinarily, a ratio of patients than they ordinarily were even budgeted for, but they just, that's what the day was. And the virtual nurse was helping a lot, like you said, making calls to physicians and following up on labs and helping, keeping patients safe. But at the end of the day, that virtual nurse the bedside nurse had a question for the virtual nurse, and that burning question. And that question was, am I doing a good job?
Mm-hmm.
And so you have this brand new nurse who is, maybe in some moral distress about the reality, and to have somebody that can provide that support and maybe head off some of that, preventing burnout of the new grads. So that's a huge piece.
Absolutely.
Wade's typing that he's cheering for you, Shannon.
Thank you, Wade.
Awesome. So, and I know we have other task force members on the line. So feel free to just type in the chat if you want to add something and be unmuted. I know we have Leslie Farrell here, and I'm multitasking a little bit, looking at the participant list, cross-referencing to our task force list. So please feel free to say, hey, I'd like to add something that I remember. I know Candace Vaughn might be on the call too from our sessions, but and that coaching and mentorship piece can't be stressed enough.
Right.
And then of course, obviously the informatics and technology is part of it because it is a virtual role. And so under that, we talked about the utilization of technology, the privacy and security and data management piece. And I don't know if you want to add anything else about the technology, Terri, as we were thinking about that domain. And it is one of the higher percentages, but it's not the dominant one.
Right. Yeah, and I think that initially, one of the things I found interesting in the room when we were actually doing this and developing the blueprint and listening to the subject matter experts, I think the perception initially was that technology and informatics was going to be a large domain.
Yes.
But as we were building out the others, we realized, oh no, it actually fits under the other domain and not just isolated under the informatics and technology. And the informatics and technology, like you said, Lisbeth, focuses on the utilization and the knowledge, skills, abilities, or competencies required to use the technology. But because of the role of the virtual nurse, technology is reflected and embedded in the other domains as well.
Excellent. And I think as we were talking about the wisdom workers, and this is not only about just the exam, but how to recruit and identify the right nurses for this role. I'm just going to read a comment of somebody that just put in the chat. And she's saying, I'm new to virtual nursing and would like to know which organizations and task force I could connect with to grow. But I love this. She said, virtual health has rejuvenated my passion and kept me in nursing when I was ready to leave. And oh, yes, we need that. We need those people to stay.
100%. And with the challenges we're facing, again, not from the pandemic, but amplified by the pandemic. Yeah. We know the moral distress, the burnout, the utter exhaustion, and the turnover intentions of our nursing workforce are significantly higher than they have ever been. We're losing nurses so incredibly fast. And this is one way we hope to be able to keep our experienced and expert nurses and allow them to find joy in their work again, 100%. So thank you so much for that comment.
Yeah, and I think as far as recruiting and identifying nurses, this can be a career path option for a more seasoned nurse. And I remember when I was early in my nursing career thinking about where's my growth, what's next, it kind of felt like you become a nurse manager, you become a nursing director.
Correct.
And you know, if you that's the only path. Of course, I've taken a complete left turn and I'm still a nurse, but I'm a corporate nurse executive. But this is kind of a pathway that reminds me a little bit of like a rapid response nurse or preceptor, or a virtual nurse can be a different career path. It's not somebody who's like, I don't really like operations or management, but I want to kind of stay engaged, but I want to do something that stretches me.
Yeah, and one other point I will make about the domains, because this also was a large part of discussion when we were doing the task force meeting in San Antonio, Lisbeth, is folks on the call, you never saw anything related to any of the specialty nursing specifically. There's no med-surg content on here. There's no ortho content on here because that's not what we're testing. This credential truly is intended to measure the competencies required to provide this model of care, not necessarily testing your nursing knowledge or your expertise in your specialty setting. And that was very much by design. And AMSN and MSNCB, while the ones that are developing this credential, MSNCB specifically, it is open for nurses outside of the acute care med-surg setting. You might be in neurology, you might be in cardiology, respirology, oncology. If this role is what you're doing, then this certification is for you. I just wanted to make that distinction because we talked about that a lot in the focus group meeting as well.
I'm going to throw a question at you, Terri, that we didn't talk about. So I apologize if you don't remember the answer, but what did we land on as far as qualifications of experience before taking this exam?
So we decided that the eligibility criteria for this exam would be 2 years in a virtual nursing role, recognizing that to get a virtual nursing role, most employers were requiring several years of nursing experience for that. So we didn't replicate. So it's not 10 years of experience, for example, it's 2 years in this role, and each employer sets what the criteria are to be eligible for this role within their institution.
Okay, so knowing that's usually a little bit more seasoned nurse.
Right,
Okay.
exactly. And when you think about it, and then when you think about the domains, you really, to be able to do those leadership domains, the communication, the coaching, and the mentoring, you're probably going to need several years of experience to be able to do the role, and that makes sense.
Yeah, that does make sense. I'm going to put my good friend Ashley Votruba on the spot. So I emailed her this morning and did not get an answer back. So, oh, I see her microphone's green, so that means that she is unmuted. But Ashley Votruba is the chief nurse of Ecomedical, which provides like staffing, virtual staffing, monitored text for virtual sitting, physicians, and she's a good friend of mine and colleague. And so Ashley, and her and I did a webinar about virtual nursing last August. So Ashley, I hope you don't mind me putting you on the spot and asking you about what qualifications do you think of for hiring virtual nurses?
Thank you for having me. We here at ECWM, the minimum experience that we hire on for our virtual nurses are 5 years in the critical access space. So it could be critical care, could be ER, but that's the minimum. All but 2 of mine are certified in their specialty field. Several of them have their masters. They teach externally from us. I think that's very important when we bring on staff. Nurses notoriously eat their young, so we want people who can embrace the next generation of nurses and grow them into being competent and expert nurses, hopefully keeping them at the bedside in their respective facilities. And then our nurses have that resource and mentor that they can give to them in a non-judgmental place, because we're Switzerland to them. We aren't hospital employees, and we're not competing for those same day shift positions or anything like that. So that's our minimum criteria. I'll tell you, I have some that are 20 plus years critical care nurses, very embracing of new nurses and the novice nurse, helping them to get to the next point in their career path.
Awesome.
Thanks, Ashley. Thanks for letting me put you on the spot.
Yes.
Looking forward to hanging out with you at Vive in Nashville next week. So we've got a few questions coming up in the chat, and so we'll spend the rest of the time, maybe 10 minutes or so, talking about questions. Here's a good one, Terri. Somebody's saying there, I'm so excited about this and cannot wait to have our nurses sit for the certification. Is the 2 years defined by days or hours worked? Or
hours. Yeah, it's usually hours, and it'll be an average, and it's not even full-time. Usually we base that on a part-time role to be eligible for the exam. Yes.
Oh, okay, great. And is the leader of the virtual nurses, and maybe you haven't even decided this yet, but is the leader of the virtual nurses qualified to take the exam, or as this is about the model? That's a good question.
Absolutely. Yeah, we did not. Again, we were really deliberate, and we had talked a lot. What funny, Lisbeth, I don't know if you remember this discussion, and your colleague mentioning the certification made me remember we had had a lot of discussion, remember, whether or not one of the eligibility criteria for the exam would be that they were already certified in their specialty, and then
Yes.
this was an add-on certification. We did not pursue that. We decided that we didn't want to limit the folks that were eligible. But yes, exactly. As long as you are connected with acute care virtual nursing, whether that be at the leadership role or the actual doing the work, but you have to understand the model and these domains and the knowledge, skills, and abilities, yes, you are eligible for the exam.
Okay, great. While we're waiting for some more questions to be put up in the chat, let's put up our another poll we had. And so based on, based on this conversation, do you have nurses at your organization that you think would currently be interested and qualified to take the certification exam, or by the end of 2023, or would nurses be interested 2024 or later? And since you clarified about leadership, those who are in leadership positions like Wade and Shannon, who chimed in, I think would include yourselves. So give a second to hear that. And let's see how this poll is coming out. Okay, so some are currently, so there you go. Terri, 32% currently, and then another 20, but sort of by the end of this year, and then many more by the end of 2024 or later. Got a few good practical questions. One is, will there be curriculum or study guides to prepare for the exam? And will the exam blueprint be published?
Yes. So yes, the blueprint has to be published. That's one of the requirements, is we have to share with you what you are going to be expected to know for the certification exam, the weightings, and sort of the specifics under. So under each domain, there are a lot more subdomains, and even down kind of to the task and knowledge level. That is public and will be posted on the AMSN website in our certification section. The second question was, sorry, Lisbeth, what was it? There was the first part of the question, I forgot.
Modules in education,
oh,
and I think
thank you.
Chance to talk about the conference.
Yeah, so we are certainly AMSN, and again, I keep drawing a distinction because it is actually an important distinction between AMSN activities and MSNCB activities. MSNCB is the certification board developing the credential. AMSN is the organization, as the membership organization, that's looking at education and certification preparation. So we won't have certification preparation materials for the first beta exam, which will be in September. But hopefully shortly thereafter, there will be some sort of preparation materials for people that are interested in the certification. But we are and have at the AMSN annual convention, which will be in September in Las Vegas this year, there is an entire track on virtual acute care nursing. So you could attend the AMSN convention, and at every time slot where there's education being offered, there is specific content for virtual acute care nursing. So you could take content for the entire convention related to this practice setting. So there will be education at the AMSN convention. If you're not able to attend the convention, as much as we would love to have you in person, that education will be available online through the online library of AMSN shortly after the convention. Usually it takes us about 3 weeks to put that education in our online library, and you could access it there.
Okay, and this reminds me of another, I think, good dialogue we had during the task force, and Shannon was a strong voice about this. Shannon Denny was that we need to provide continuing thought leadership and we have that responsibility, just all of us as nurse leaders. And so that's one way that you're doing it. AvaSure, we're doing a learning series, and Shannon's, authoring studies, and it's all part of the code of ethics for nursing, I think, provision 7.3. But here's another really good question, and I'll take a stab at answering, and feel free to chime in if you want, Terri. But how are organizations addressing the responsibility of the virtual nurse, since most cannot do physical assessment of the patients? I will say that from the AvaSure customers that are doing virtual nursing, about 10% of the visits we see are scribing visits. So a virtual nurse can, and you can work within your own organization about how to document this, but can scribe the physical assessment of the bedside nurse, which is not only kind of takes the documentation burden off the bedside nurse, but also it's great for the patient to kind of hear what, the thinking out loud along with the physical assessment. So that's one way. And I've also, am aware of woundostomy certified nurses, being a second pair of eyes. And so I don't know if you have anything to add about the physical assessment piece. I mean, we will always need hands-on bedside nurses, of course.
Yeah, absolutely. And I think the domains reflect that, because if you consider the domains in the interprofessional collaboration, it's intended to have the partnership be between the persons or team members that are at the bedside physically able to do the physical assessment, and the virtual nurse who would be a consumer of that information or the information that came out of that, but also looking at other metrics and parameters and putting all of those pieces together. So I think the certification blueprint or content outline sort of further demonstrates, Lisbeth, that interdependency and interdisciplinary management of the patient.
I'm going to ask one last question from the chat, and I don't know if you even have an answer for this, but is the nurse informaticist who's helping to establish the program for their organization eligible to sit for the exam?
Yes, absolutely.
Great. And then some other questions are coming up about that we will probably be talking about in our next session, and sessions coming up. So I want to share that too, what's coming next in this learning series. So we're trying to have it at lunchtime and in a consistent time. So that the next one is introducing the clinical resource telenurse model, and that is probably what we're really talking about now, really focused on med-surg and helping with admission and discharge and documentation and scribing in that setting. And somebody was asking about the staffing plan. So we'll dive deeper into different staffing plans depending on the model. There's no one answer to that. And then in May, we'll be talking about the expert oversight telenurse model, which is where a high acuity cohort of patients is being monitored virtually. That then it tends to be a much bigger group of patients that the virtual nurse is covering, but they're honed in on the most acute, complex, deteriorating patients. And then building a virtual nurse business case and what's really the value proposition that virtual nursing can bring. And I think we're seeing a lot of people start with the very simple and measurable ROI from a telesitter program. So in combining and helping, that can help even fund starting to pilot a virtual nursing program, but also there's efficiencies within making sure that everybody's working at the top of their license and the cost, the labor cost per patient day. And then selecting the right technology partner, and then starting and scaling your virtual nurse program. So hopefully we'll be seeing each other once a month and having lunch together, those of us who are on the East Coast. And I just want to thank you again, Terri, for taking the lead on this. And I really appreciated the rigor that you're putting in. And I hope everybody can hear that. There's a lot of rigor that's put into this certification, and I love that we are establishing, as nurse leaders, establishing this role and kind of what the scope is and will be.
Well, thank you, Lisbeth, for your active and support, your active role and your absolutely unwavering support for this, because it's through folks like yourself and the other task force participants where we actually are able to design a good certification program that's legally defensible and accurate in measuring the competencies of those virtual nurses. So I'm very grateful for you and for everyone else that participated. Please, I will just put a plug in again. If anybody's interested in participating in item review, that would be incredibly helpful for us to maintain our timeline to get the certification launched in September. And reach out, my email's in here, and please reach out at any time.
Okay.
Such a pleasure to do this with you.
I want to make sure your email is in the chat.
Yep.
Okay. All right. Do you want to say it verbally?
Yes. So Terri, Terri .Hinkley, Hinkley @amsn.org. The certification will be live in September. It will be beta testing. What that means is we test the actual items, and then we use the data from the folks that took that exam in the first cycle to set the passing score, and then roll that exam out formally and officially in later this year, probably December, but it will be available in September for folks that would like to participate in the beta exam. You still do get the credential. I want to be clear, you're not just testing it. You still do get the credential. There's just a couple of additional steps on our side to make sure that the exam's measuring what it's supposed to be and to set the passing score for the exam. That's why we call it a beta.
Okay. Okay. Excellent. And follow-up emails will be sent with some of this information, and those are some of the questions coming through too, as well as the a link to the article that Chen and Denny co-authored on virtual nursing, the new reality. And so great. Thank you, everyone. And we'll see you next month.
Enjoy your chili, Lisbeth.
I can't wait.
All right. Thank you, everyone, so much. Talk to you soon.
Okay. Bye now.